Have you noticed that the way you touch yourself at 60, 70, or beyond does not always match what your body actually needs now? You are not the only one. I hear this constantly from older men, not just the question, is masturbation still okay? But how to do it safely so it maintains your health instead of slowly working against it. I am Dr. Emily Grant, a urologist. I have helped thousands of men stay in tune with their bodies, feel confident in their sexuality, and age with strength and dignity. Today we are going straight at a topic most people avoid but should not. How to masturbate safely after 60, and 3 common mistakes that quietly undermine erections, pelvic health, and peace of mind. This is not about shame, and it is not about performance. It is about keeping blood flowing, respecting your prostate, supporting hormones and stress systems, and protecting sleep and mood, the foundations that make intimacy feel easy instead of forced. Give me 60 seconds, and you will understand why your routine needs a tune-up now, and how a few small shifts can make everything work better. Quick reality check. Most men over 60 get at least 2 of these wrong. Fixing them is simple and gentle, and you can start tonight. As we age, skin gets thinner, nerve signaling slows a bit, and blood vessels become more reactive. That means the old way you used at 25 may rely on speed or pressure your tissues do not love anymore. Adjusting is not weakness. It is smart maintenance for a body that deserves respect. If you have ever wondered what is normal and what is safe at this stage, you are exactly where you should be. Stay with me to the end. I will give you a 30-second self-check and the 3 habits to avoid so your solo practice supports your health, not drains it. Let us start with the why, and then fix the how. Why this matters now. Before we touch the how, let us anchor the why. Masturbation is not a guilty shortcut. It is a simple health practice, especially past 60. Done wisely, it keeps blood moving through erectile tissue, helps the prostate clear, reduces stress signals, and supports deeper sleep. That is not fantasy. It is how your body's plumbing and nerves work together when they are given time and safety. But here is the part most men were never told. The method you used at 25 does not automatically serve the body you have at 65. Skin thins. Nerve transmission slows a touch. Blood vessels become more reactive to stress. The pelvic floor, those sling-like muscles at the base of the pelvis, can hold tension without you realizing it. So the old fast and hard get-it-over-with routine can quietly fight everything you want. Comfort, responsiveness, and an erection that does not feel like a tug-of-war. This is not failure. It is maintenance. You tune your car. You adjust your glasses. Your approach to pleasure deserves the same respect. Big mistake number 1. Rushing the process. This is the most common one I see. Rushing trains your nervous system to stay on alert. Shoulders up, breath shallow, mind scanning for interruption. In that state, arteries do not open fully. The penis does not receive deep, nourishing flow. It gets a flicker of pressure without the calm that lets sensation build. What that looks like in real life. You start tense and try to finish faster to get it done. You notice less sensation, so you speed up more. You finish, but feel oddly unsatisfied, or you do not finish and feel frustrated. Over time, arousal feels mechanical, not responsive. If that sounds familiar, it is not your willpower, it is your state. Your body is waiting for a different signal. Safe to soften. How to fix it tonight, which takes 90 seconds. Arrive first, touch second. Sit or lie down. Exhale slowly through the mouth. Then take 6 slow nasal breaths. Feel your belly rise. Ribs widen. Chest expand. On each exhale, deliberately drop your shoulders and unclench your jaw. Relax the pelvic floor. Imagine you are about to urinate, not actually doing it, just enough to release the lift and clamp. Hold 2 seconds, release 4. Do that 5 times. Set a tiny buffer. Put your phone in another room. Lock the door or tell yourself, for the next 5 minutes, there is nothing to respond to. That one sentence shifts your brain from guard to receive. Start with warmth, not friction. Warm your hands. Add a drop of unscented, neutral lubricant. Touch the skin like you are checking for temperature first. Wait for your body to lean into the contact before increasing rhythm. You do not need candles or a ritual. You need 60 to 120 seconds where your body hears, "We are not in a hurry." When you do that, vessels widen, nerves wake, tissues respond. The difference is surprising for most men. Speed stops being the lever. Presence does the work. Signs you are still rushing, so you can self-correct. You are holding your breath on the upstroke. Your glutes or abs are clenched the entire time. Your mind is counting time or scanning sounds in the hallway. You finish and immediately feel the urge to stand up or check your phone. Pick one of those tells and make it your red flag. The moment you notice it, pause for 2 slow exhales. Soften your grip. Soften your jaw. Then continue. That 10-second reset changes the whole session. Your body wants coaxing, not forcing. Think of arousal now as accumulation, not ignition. At 20, pressure and speed alone might carry you. At 60 plus, dose and pacing do more than force. When you give your body a steady signal, gentle, rhythmic, patient, erectile tissue fills more evenly. Sensation grows instead of flickering. The result is not just finishing. It is finishing without the next day ache or the "why do I feel empty" drop. Here is a simple 2-minute warm-up map you can keep. From 0 seconds to 30 seconds breathing, shoulder drop, jaw release. From 30 seconds to 1 minute light contact around the shaft and base without stroking. No goal, just waking up receptors. From 1 minute to 1 minute 30 seconds slow circles at the base and along the perineum, the area between scrotum and anus, with a gentle hand through fabric or with plenty of lube. From 1 minute 30 seconds to 2 minutes begin a slow stroke. Think glide, not scrub. If sensation dips, slow down. Do not speed up. 2 minutes is nothing yet. It often triples satisfaction because you are working with your physiology instead of against it. Big mistake number 2. Overusing pressure. The so-called death grip trap. Let us call it what it is. When sensation dulls, most men tighten. The tighter you grip, the more you compress the very tissues you are trying to enliven. Think of squeezing a sponge until water cannot circulate, then expecting it to feel wetter. Over months or years, that can train your body to respond only to one specific combination of pressure plus speed, and almost nothing else. Typical signs you are sliding into the trap: you need a very narrow, exact stroke to feel anything. Partner touch feels not enough, even when you want it. There is occasional soreness, redness, or micro-irritation afterward. You feel fine during, but notice less sensitivity the next day. The gentle reset, and no, you will not lose it. Loosen one notch below where you think you need to be, then add lubrication to replace friction with glide. Change angle, not force. Rotate your wrist 10 to 15 degrees. Vary the path. Include the underside and base. Nerves respond to novelty. Add pause points. Every 20 to 30 seconds, stop at the top for a 2-second squeeze of the pelvic floor, followed by a 4-second release. That release is where sensitivity rebounds. Think 70-30. 70% light to moderate, 30% brief, firmer moments. That ratio preserves sensitivity while still giving you peaks. If loosening feels strange the first few tries, that is normal. You trained a pattern. Now you are training a better one. Most men adapt within a week or two when they keep the rhythm steady and the breath moving. A quick word on lubrication, it matters more now. Past 60, natural moisture and skin resilience change. A neutral, fragrance-free lube reduces microfriction and protects delicate vessels. Start with a pea-sized amount and add one small drop anytime glide decreases. If you ever feel warmth turning into sting, that is your cue to pause, add lube, and slow the stroke by 20%. Micro challenge for tonight. Give yourself 5 minutes total. 2-minute warm-up map, as above. 1 minute slow, lighter than usual stroke with added glide. 1 minute experimenting with angle changes rather than pressure. Final minute, breathe out longer than you breathe in, then rate the session on 2 scales. Comfort from 0 to 10 and sensation quality from 0 to 10. Your goal is not a number, it is noticing which small shift gave the biggest improvement. That awareness is what sticks. Coming up next, stay with me. We will tackle the third, sneakiest mistake that has nothing to do with your hands and everything to do with your head and heart. And I will walk you through a 30-second self-check that flags whether tension, not technique, is stealing your responsiveness. Plus, a simple doctor-approved routine to keep your prostate and pelvic floor happy without strain. Now, let us take this one step further because fixing mistakes is only half the story. What really matters is building a routine that supports your health, feels satisfying, and actually makes you look forward to these moments instead of rushing through them. So, here is the framework I teach my patients, and it is something you can start using right away. Think of it as a 4-step check-in every time you are about to touch yourself. Step 1. Your environment. Most men underestimate this. But your body responds directly to how safe and private you feel. If you are constantly listening for footsteps or worried about being interrupted, your nervous system never leaves alert mode. That alone can reduce blood flow, delay arousal, and make release feel shallow. The fix is simple. Give yourself permission. Create a quiet window, maybe 10 or 15 minutes, where you can close the door, silence your phone, and actually be present. Step 2, your touch. We already talked about pressure and rushing, but let us go deeper. Ask yourself, am I chasing sensation, or am I allowing it? There is a huge difference. Gentle variety, slow strokes, changes in rhythm, using a little lubricant, can reawaken sensitivity you thought you lost. It is not about working harder. It is about working smarter, with kindness instead of force. Step 3, your breath. This is the one most men never think about. Shallow, fast breathing keeps your body in stress mode. But when you slow down, take a few deep belly breaths, and relax your jaw and shoulders, something shifts. Your blood vessels open, your pelvic muscles loosen, and arousal feels fuller and steadier. Even 1 or 2 mindful breaths can change the entire experience. Step 4. Your mindset. Here is the truth: your body and brain are one system. If you are carrying shame, guilt, or performance anxiety, your body remembers. That tension lives in your chest, in your breath, even in your erection. Instead, try this. Before you start, tell yourself, this is healthy, this is good for me. It sounds simple, but reframing self-pleasure as self-care rewires how your body responds. When men practice these 4 steps, something amazing happens. Not only do they enjoy themselves more, but their overall health improves. Erections become more reliable, sleep feels deeper, stress levels drop, and even confidence in partnered intimacy goes up. And here is the most important takeaway. Your body is not failing you, it is asking you to evolve with it. The techniques that worked at 25 do not necessarily serve you at 65, and that is not loss. That is wisdom. It is your body guiding you toward a slower, richer, more nourishing kind of pleasure. So tonight or whenever you feel ready, try it. Give yourself a little extra time. Loosen your grip. Breathe deeply. And treat the moment as something valuable. Not a quick release, not a guilty habit, but a practice that protects your circulation, your prostate, your hormones, and your peace of mind. You deserve that, at any age. And if you found this helpful, make sure to subscribe. Because in the next video we will go even deeper into what your doctor probably never told you about male sexual health after 60. Until then, take good care of yourself and remember, when you respect your body, it respects you back.